Vitamin C, it is also called ascorbic acid. So this is important exam point. They ask you which of these is vitamin C, and they give you options: acetic acid, ascorbic acid, glutamic acid, aspartic acid. So you must know that vitamin C is ascorbic acid. So its other name in itself is an exam question. Now, what is the function of vitamin C? Vitamin C requires, it is required for synthesis of collagen. It is coenzyme for the process of synthesis of collagen. And collagen is the most abundant protein of our body. Most abundant protein. Everything is made up of collagen, but I'll mention few things here. The whole connective tissue, the muscles, the skin, most of the things are made up of collagen. But I'll mention few things. For example, gingival fibers, because being dentists, we are more concerned about oral cavity. Gingival fibers, periodontal ligaments or periodontal fibers, they are made up of collagen. So deficiency, that will lead to a disease called scurvy. Deficiency of vitamin C leads to a disease called scurvy. What happens in scurvy? It is forming collagen, so whatever requires collagen, that process will not happen or happen very slowly. So in scurvy, there is delayed wound healing. Why? Because when wound heals, the collagen must deposit in the wounded area to rebuild that structure. To rebuild, a lot of protein is required for growth, for repair. So delayed wound healing. Wounds of these people don't heal properly. And even if they heal, they leave scar. A lot of scars and marks will be left behind. Then there will be gingivitis or periodontitis with minimal plaque or calculus. So even if plaque or calculus is minimum, still the gingiva will be inflamed. There can be periodontitis, there can be pockets. Gingivitis usually presents with bleeding on probing, so gingival bleeding can be there. So these you have to know. Firstly, what is vitamin C called? It is called ascorbic acid. Its deficiency cause which of these? That is again a very frequent exam question. Deficiency causes scurvy. And all the things which need protein may it be growth, may it be repair, may it be general remodeling of the body, all such processes will be delayed. Next, coming to fat-soluble vitamins. Fat-soluble vitamins. They were vitamin A, D, E, and K. So first we start with vitamin A. It exists in three forms. That is retinol, retinol, and retinoic acid. Now these three forms, they help in, so this is coenzyme for synthesis of pigment rhodopsin. These vitamin A, it is required for synthesis of retinal pigment rhodopsin. So what is the function of vitamin A? That is again a very important exam point. You must know. It is required for synthesis of rhodopsin. Rhodopsin is pigment of rod cells. If you remember, retina has two types of cells, the two photosensitive cells. They are rod cells and cone cells, out of which the rod cells have got rhodopsin, and they are responsible for vision at night. It doesn't mean night as such, but vision in dark. You know, in dark areas, we don't go completely blind. For example, we are walking through a dark street, we can still see somebody who's walking along with us. Maybe it's not very clearly visible. I mean, we cannot see very far, but we can still, you know, when it is less light, of course, it should not be completely dark, then we won't see anything. But the kind of darkness we have at night, there is moonlight, we have stars, little bit light. So little bit vision is there. So that is rod cells functioning at that time. And when it is bright light, cone cells function at that time. So this is responsible for vision during day. Now, in vitamin A deficiency, rhodopsin will not be there, rod cells will not be functioning. So Deficiency of vitamin A causes night blindness. These people, they have normal vision during bright light, that is during day, but at night when it is relatively dark, they go completely blind. They cannot see at all. This is called night blindness. They become blind at night, which means that at night the rod cells were responsible for vision, and the rod cells will not be functioning anymore. So the patient suffers from night blindness. Not only that, there are changes in the conjunctiva or various other parts of eye. So there is dryness of conjunctiva. Conjunctiva is the superficial layer, and cornea, and this is called keratomalacia. So all you have to know is that deficiency of vitamin A leads to night blindness and keratomalacia. Of course, vitamin A should be supplemented in these patients. And then we have vitamin D. Vitamin D, you must have heard or known that this is good for bones. So it is required for normal formation and mineralization of bones. Now, a very important point about vitamin D is it's the only vitamin synthesized in body. It's the only vitamin synthesized in body. You must be knowing that sun exposure is very much essential for vitamin D. The UV light that triggers the reaction of vitamin D synthesis in skin, and the reaction requires liver and kidney for its completion. So sun exposure, good amount of sun exposure is very essential for healthy bones. Deficiency of vitamin D. This is very, very important exam question. Deficiency in children is called rickets, whereas deficiency in adults is called osteomalacia. So firstly, the names itself is exam question. Deficiency in children is called what? It is called rickets, and deficiency of vitamin D in adults, that is called osteomalacia. Why do we have different name for the same disease? It's the same disease, then why do we have different name in children and adults? Why? Because it is much more severe in children. and it will have lot of complications, whereas in adults it will be relatively easy. Why? Because in children the skeleton is still forming, the bones are still forming, child is growing. If there will be lack of vitamin D, the bones will be weak, bent, child will never reach his full height, what the child would have been if vitamin D was good. So bony deformations, small stature, the back can be bent. So the whole life of the child changes. Child is kind of crippled. But in adult, the bones have already developed. It's just that if vitamin D will be less, there are more chances of osteoarthritis. So there can be bone pains and things like that. And if you replenish vitamin D, things will be fine. But in children, once the bones are bent or the child is small, bones are deformed, even if you provide vitamin D, they cannot get back to normal. So the outcome of vitamin D deficiency in children will be much, much severe because bones are still forming. That is why we've got a different name for children and adults. Excessive of vitamin D, it can cause excessive calcification, so it can cause hypercalcemia. That means excessive calcium, hypercalcemia, and metastatic calcifications. Metastatic calcifications is the calcifications start forming here and there. Which means, for example, kidney stone can form, stones can form here and there. Next is vitamin K. Vitamin K, it is required for synthesis of clotting factors. That is 2, 7, 9, and 10. You must be knowing that there are 13 clotting factors. They go through a series of reactions and finally result in clot. Out of those 13, these 4 factors, 2, 7, 9, and 10, they require vitamin K for the synthesis. So deficiency, that will lead to bleeding tendencies. If severe deficiency is there, bleedings can happen from here and there, depending upon how severe is the deficiency. With minor cuts and wounds, people will excessively bleed. Then is vitamin E. Nothing much important about vitamin E, but you have to know its other name. Its other name is tocopherol. So they ask you which of these is vitamin E, tocopherol. So name for vitamin C, which is ascorbic acid, and vitamin E, which is tocopherol. These two names you must know. It is a good antioxidant, and all you have to know is that it is good for skin. That's it. You must have heard almost all the cosmetics or creams and lotions, they have good amount of vitamin E. Why? Because it is good for skin, that's it. Sometimes they ask you which vitamins have antioxidant property or which vitamins don't have antioxidant property. Remember, antioxidant property, you have to write all the vitamins in a line, A, B, so vitamin A, vitamin B, vitamin C, vitamin D, vitamin E, and vitamin K. So antioxidant property, first one has, second one don't have. Third one has, fourth one don't have. Then this one, fifth one has, sixth one will not have. So if you write them in sequence, A, B, C, D, E, K, and then just go like this. So A, C, E, those have the antioxidant property, whereas B, D, and K will not have antioxidant property. This is how you can memorize. So they can ask you which of these have the antioxidant property, which of these don't have antioxidant property. You should be able to answer that. So that's all from your coenzymes or vitamins. This section, I mean, this just one page or 2 pages, whatever, related to coenzymes, you get 4 or 5 questions out of it. Why? Because mostly it is kind of summary of the biochem. For example, transaminase requires which coenzyme, pyridoxal phosphate, or the rate limiting step of fatty acid synthesis require what? They require biotin. What is the vitamin synthesized in our own body? That is vitamin D. Then the whole story of niacin causing pellagra, thiamine deficiency causing beriberi, dry beriberi, wet beriberi, Wernicke-Korsakoff syndrome. So each of these points you must know. You get 3 or 4 exam questions from the coenzyme section. Now, in your books, you will see things like this: these foods are rich in this vitamin. You can read that, and if you can retain that, that's fine. But whatever we have done in class, that is kind of must know. First, you should be very firm with what we have done in class, and then you can read your books, even though that is not necessary. Whatever we have done in class is more than enough. Okay, one point we missed about vitamin K. It is also synthesized by colon flora. Before that, we said that biotin is synthesized by the intestinal flora or large intestinal flora or colon flora. Not only biotin, but vitamin K is also synthesized by bacteria in large intestine. Is that clear to everyone? Okay, now we are done with the biochem. We have to start with microbiology. We have to start with micro. You know, micro, it's the study of microbes. So first we'll do the introduction to microbes. Now, microbes can be, we'll study few definitions. First is resident flora. You know, microbes, they are in general the residents of an area. They're called flora of that area. So, first definition about microbes you're going to do is resident flora. As the name itself says, it is residing in a particular area. So, resident flora is those microbes which live in or on our body. So, you know, a lot of flora is there on skin, a lot of flora is there in oral cavity and inside body also, especially in colon, there is a lot of flora. So, those bacteria or those microbes which live in or on our body, they're called resident flora. If disturbed, they will soon come back. Let's say somebody has got tooth infection and we have to go for antibiotics. We give him antibiotics. Those antibiotics will not only kill the bacteria causing tooth infection, but they will also kill all the bacteria present in our colon. So that is what I mean by when disturbed. When disturbed means when killed somehow. Let's say due to any infection in our body, we had to take medicine, and those medicines, they will not only kill the disease causing ones, they will also kill the resident flora. But after we stop the medicine, these will soon come back. They will be built again. Just like oral cavity, we brush our teeth, we kind of remove them by brushing and they build up again. So we have to do it every day, twice a day rather. Why? Because they come back. So resident flora, they are living in or on our body, and if disturbed, they will come back. They always stay. And then we have another definition. Those are transient flora. Transient flora, they depend upon external environment. They depend upon external environment. What do we mean by that? They depend upon external environment. For example, if outside it is hot, some kind of bacteria will be living on our skin. And if the weather changes to cold, the hot type of bacteria, they will go and the bacteria which live in cold weather will come. Similarly, if the environment is humid, some kind of bacteria will live. If it is dry, some other kind of bacteria will come and live. So as the external environment changes, the flora changes. So if we go from one place to the other, we will change the flora also. I mean the transient flora. Resident flora will remain wherever we go. These are not going to go. They live forever. But transient flora, they depend upon the external environment. As the external environment changes, this flora changes. And these are, of course, the normal flora. These transient or resident flora, they are the normal flora. And what do we mean by normal flora? They are non-pathogenic. That means non-disease causing. They don't cause any disease. For example, the flora in our oral cavity, it's not causing any disease. Flora in large intestine, it's not causing any disease. Rather, they can be helpful. They can protect us from certain infections, and also, the colon flora that is producing vitamin K and biotin. So they are producing something which is useful to us. So these normal flora, they're useful to us. That is why there is a lot of, discussion that we should use disinfectants to clean hands, or disinfectant soaps, and solutions are there. So initially these came and these became very famous, but now they're saying that we should not over clean our hands or whatever. I mean, it should be normal soap which will remove all the soil or dirt, but it should not be disinfectant. It should not have something antibacterial. Why? Because the normal flora is good and protective. So if we keep over cleaning, we are removing the normal flora, we are removing protection, and will be more prone to infections and will be more prone to allergies. So in many states in US, use of disinfectant soaps is banned now. Also, it is causing antibiotic resistance in bacteria. So overuse of antibiotics or detergents or soaps or disinfectants is not recommended. Why? Because we should not disturb the normal resident flora. Then we have to talk about normal flora in certain areas. Normal flora on firstly skin. You have to memorize these names. We will go into details of each of these, but for now you just have to directly know certain names. Skin, so we have Propionibacterium acne. It is acne causing bacteria. It causes pimples. Then diphtheroids. And then we have Staph aureus, Staphylococcus aureus. Staph aureus or Staphylococcus aureus, it is present on skin in about 30% of people. 30% of population has it on skin, and it is a very virulent bacteria. Very virulent, what do we mean by very virulent? Very efficient in causing diseases. What diseases it causes and how it causes will do. But if it is virulent, then why is it normal flora? If it is very efficient in causing diseases, then why is it among the normal flora? In fact, till it is on skin, it will not cause any problem. Till the skin is intact, it will not cause any problem. It will just stay on skin. But if there are any cuts or wounds, it will get access to the underlying tissue through cuts and wounds. For example, small shaving cut or hair follicle. I mean, if a hair is plucked, the follicle will be left open and naked for some time. So in such situations, the Staph aureus might get chance to enter into that wound or the hair follicle if it is there on skin. And once it gets entry to the body, then it will cause diseases and problems. So while on skin it is normal flora, but if it gets access to underlying tissues through cuts, wounds or injuries, then it will cause problem. So it is very virulent and causing diseases only if it happens to enter into the body. On the surface, it is not doing anything. Then oral cavity. Oral cavity has lot of flora. Majorly, it is streptococci. Majorly streptococci. Then we also have staphylococci. Even candida is normal flora. Now you might think that candida causes candidiasis. It is capable of causing a disease, and how come it is normal flora? Candida causes candidiasis only if patient's immunity is compromised. In a healthy person with normal, vibrant immunity, no fungi can cause diseases. Fungi, they cause infections only if person is immunocompromised. Due to some reason, the immune level is low. So only if somebody is weak, malnourished, suffering from some other disease which has made it very weak, only such individuals candida will invade and cause problem. In a normal healthy person, candida cannot cause candidiasis. Or there should be some localized problem. For example, an ill-fitting denture. So something wrong with denture or something wrong with prosthesis, it might start growing under that prosthesis. So some problem must be there. In a healthy person, it will not cause problem. Hence, it is normal flora. The nasopharynx has very little microbes. It will cause Streptococcus pneumoniae. So Streptococcus pneumoniae and Neisseria, they are commonly there. Then stomach, it is sterile because it is very acidic. No bacteria can survive in such a strong acid. So stomach has no bacteria. Small intestine also has very little, so it is also majorly sterile, very little bacteria. Whereas colon, it has huge amount of flora. Those are Clostridium species, E. coli, Pseudomonas. All you have to know is that colon has huge amount of flora, and then vagina in non-childbearing years, its flora is similar to skin. So whatever we've done in skin. What are non-childbearing years? Before puberty and after menopause, when the female is not capable of producing a child. And in childbearing years, its flora is similar to oral cavity. So all the streptococci, staphylococci, those will be predominant. So when it is kind of non-functional, the flora is similar to skin and colon. The colonic bacteria, they keep coming and keep invading the vagina also. And in childbearing years, it is similar to oral cavity. Is that clear? Then we have two more definitions. First is primary pathogens. Firstly, you must know pathogen is something which can cause pathology or which can cause disease. So primary pathogens, they are those which can cause disease in a healthy person. So primary pathogens are those which can cause infection and disease in a healthy person itself, whereas secondary or opportunistic pathogens, they cause disease. They cannot cause disease in a healthy person, cannot invade a healthy person, but cause disease in immunocompromised person. So if anybody is immunocompromised, for example, having some immunocompromising diseases like AIDS, or any person taking some immunocompromising drugs, there are some medicines which are immunosuppressants. So if anybody is on those kind of medicines, their immunity will be very low. So even those pathogens which usually don't cause infection, they also will start attacking because the person has become weak. Such pathogens are called opportunistic pathogens. They're taking advantage of the opportunity they've got. Is that clear? Next is virulence factors. I'm going to open a new page. Virulence factors. What do we mean by that? Now, these microbes must have something which make their entry into body and their survival in host possible. They should have something with help of which they're able to hide from the immune cells. They're able to hide from the immune attack from the antibodies. They're able to, you know, grow, divide, and cause damage to the host and cause disease. What are those things which make all this possible? Because if any foreign thing enters our body, our immunity will attack it. Then how these become successful in causing problem? One of the virulence factors is enzymes. They have got some special enzymes which help them in invasion. For example, hyaluronidase, protease, collagenase, coagulase, and collagenase. Now, any bacteria which is capable of producing proteases, it will break down the host proteins and will enter into the body. Coagulase will cause coagulation of blood and it will hide in that clot. Collagenase will cause breakdown of collagen protein, which is most abundant protein. So it is also capable of destroying the proteins, which will help it enter deep and deep into host body. Hyaluronic acid, if you remember proteoglycans and glycoproteins, remember we did hyaluronic acid is most abundant proteoglycan. So hyaluronidase will cause breakdown of hyaluronic acid. This will also help the bacteria to pass through connective tissue. And then these bacteria have surface component, surface component, which is capsule. So these bacterial capsule, you must know it is made up of polysaccharide. This is exam question. What is bacterial capsule made up of? Some bacteria have it, not all. Some bacteria, outer to their cell wall, has this special covering called capsule, which will protect it from the attack of immune cells. The neutrophils, macrophages, they tend to attack the bacteria, but the capsule will protect the bacteria. So this is exam question. What is bacterial capsule made up of? It is made up of polysaccharides. So whenever you study, you just speak it as one word, polysaccharide capsule. Bacteria has polysaccharide capsule. Examples of bacteria which has it is Streptococcus pneumoniae. This example also is exam question. They ask you which of these bacteria have got a capsule. Remember, Streptococcus pneumoniae is an example of bacteria which has got capsule. And then the bacteria can produce toxins which damage the host body. These toxins will be of two types. They are called endotoxins or exotoxins. Now the basic difference between them is that exotoxin, it is released by bacteria. So bacteria is releasing this toxin to damage the host cells. Whereas endotoxin is never released by bacteria. It is part of bacterial cell wall. Part of bacterial cell wall. When the wall rupture, toxin is released. Toxin comes out. So it is not released by bacteria. It is something present in bacterial cell wall. As the bacteria will die, wall will rupture. So something comes out of that wall which happens to be toxic to host. So bacteria never intended to release it. Bacteria didn't even know that it is having a toxin. It's just that some component of bacterial cell wall is proving to be toxic for us. So it was never released by bacteria while it was alive. Only when the bacteria die, wall rupture, it automatically comes out. And when it comes out, it happens to be toxic for us. It is damaging for us. Whereas exotoxin, it was released by a living bacteria with intention to damage the host. Endotoxin is present in gram-negative cell wall only. So it is a feature of gram-negative bacteria, whereas exotoxin is released by both gram-negative and gram-positive. Then remember that it is part of cell membrane that I already told you, and this is released. It is lipopolysaccharide in nature. Chemically, what it is lipopolysaccharide. And this one, it is a protein. So it is heat labile, and this is heat stable. What do we mean by that? You know, proteins coagulate on heating. You can take example of an egg. An egg is liquid when raw, but when you cook it, when you heat it, it becomes solid. Why? Because it is rich in proteins and proteins coagulate on heating. But they get denatured, they become non-functional. So exotoxin is protein. When you heat, the protein will get denatured, it will coagulate, it will not function. So that is the whole story behind cooking. Before eating, we nicely cook the food. Why? Because if any exotoxins are there, those coagulate and become ineffective. So if we nicely cook the food, we should not be afraid of exotoxins. But endotoxin, it is heat stable. Even if you heat it, it is able to withstand heat. It will remain unaffected. So if in some food or something there happen to be endotoxins, even if you cook it well, even if you heat it nicely, the endotoxin will still not get destroyed and it can still make you sick. Is that clear? So that's all about introduction to microbiology. We stop here. Next class, because micro has three sections: bacteriology, virology, and mycology. So we'll first start with bacteriology. So the next topic we'll be doing is bacteriology. That's all for now. And tomorrow it's Christmas, so we will not be studying tomorrow. So it will be a long weekend. Enjoy your festival. See you guys after weekend. Bye everyone.